Sarai,
Yeah, we are live right now. We are live on the Facebook. So warm welcome to all of you, particularly my good friend Dr. Patta Radhakrishna. Thank you for joining us, and I just leave it to Dr. Srijayan for the formalities.
Okay, very good evening to all. Thank you, Radhakrishna sir, for joining us and sparing some time with the surgeons of Kerala. I know that you have nostalgic memories of Kerala. And for the introductory words, I welcome Dr. Shafiq, and then we will continue. Shafiq, please go ahead.
Thank you, sir. Good evening and welcome everyone to episode 14 of Surgical Musings brought to you by ASI Kerala chapter. Surgical learning in the 21st century is no longer confined to textbooks and teachers or patients and procedures. There is another element which has brought about a radical change, I would say a disruptive technology, which has added on as a very valuable resource for learning, both for young and as well as old surgeons. So today with us, we have a very distinguished speaker, the man behind, I would say, one of the, or perhaps the most popular Facebook group, also on YouTube, which I almost follow on, however busy I am, before going to bed. I have a look at this site. It never ceases to amaze me, the content that is there. So I don't think Patta Radhakrishna sir needs an introduction to this crowd or any surgical crowd in the country. So I will leave it to our chairman, Dr. Srijayan sir, for the further proceedings. Over to you, sir.
Thank you, Shafiq. And as Shafiq said, the Learning in General Surgery platform is a very interesting platform, and almost 42,000 members are there in the Learning in General Surgery platform, where many seniors exchange their wisdom and knowledge. And there are a lot of interviews also, and it's a very excellent platform where we can learn the different areas of surgery. Dr. Patta Radhakrishna is the Director and Senior Consultant of Surgical Gastroenterology, Institute of Gastroenterology and Hepatobiliary Science and Transplantation at SIMS, a corporate hospital in Chennai. And he has vast experience of about 30 years in the field of gastrointestinal surgery. He was graduated from JIPMER Pondicherry in 1986, obtained his MS in General Surgery from Stanley Medical College in 1980, and MCH Surgical Gastroenterology in 1992 under the chairmanship of Professor N. Rengabhashyam, Department of Surgical Gastroenterology in Madras Medical College. 3.5 years he had worked as a senior resident in the Department of GI Surgery and Liver Transplantation at the All India Institute of Medical Sciences, New Delhi, under Professor Samiran Nandi. And Dr. Patta Radhakrishna had an extensive experience in the laboratory work in relation to liver transplantation, and had the opportunity to be involved in the first ever liver transplant done in India, that is in All India Institute of Medical Sciences in 1995. And after completion of his training in AIMS, he joined as a consultant GI surgeon at Sri Venkateswara Institute of Medical Sciences at Tirupati. Later, he has joined on Nizam Institute of Medical Sciences at Hyderabad, and he had a 3-year stint as a senior consultant in GI surgery at Sedech Sigdar Women's Medical College Hospital at Dhaka, Bangladesh. And also in 2003, he had joined at Apollo Hospitals, Colombo, Sri Lanka, the largest multi-specialty medical care provider in the entire Sri Lanka, and worked for 3 years as the senior consultant and head of the Department of Surgical Gastroenterology. And he came back to India, and he was working with Apollo Hospital, Chennai. And as I said, Learning in General Surgery is a major Facebook platform run by Dr. Patta with more than 42,000 members. A lot of senior surgeons are members and here and keep sharing their surgical wisdom on a daily basis. This is the most popular online platform for surgical learning since 2013. And in the initial piece, I was talking about association in Kerala. He was in Medical Trust Hospital, Cochin, for almost 3 years. So let us join together and welcome Dr. Patta Radhakrishna for his talk on the subject making of the surgeon. Thank you, sir. Thank you for joining with us with the Association of Surgeons of India Kerala chapter. Please go ahead.
I start with paying my respects to all the giants of surgery in the Kerala chapter of Association of Surgeons of India. And thank you so much, Dr. Srijan, for this opportunity. I feel very small in front of all the giants there. And actually, my talk will be nothing of philosophy. It's just a dilated aspect of what Dr. Srijan has already said about my journey. And I'll say, I'll take the journey college by college, hospital by hospital, and say what is that I learned and what is that I've unlearned. If I can share my screen, I should be permitted to share my screen, please.
You can do that now.
Yeah. I hope you can see my screen now, sir.
Yeah. But good.
Good evening once again to all the office bearers of the Kerala chapter of ASI and all the senior members of the faculty. There's so many of them for me to take names. And now I'll talk as a story, but I'll not, as I said, bring any great philosophy of becoming a surgeon. And so actually, I've been a fairly good student in school. And unfortunately, whenever you're a good student in school, I mean, everybody hypes up your ego so much that, you know, you're the ultimate and this and that and that. Till I went to JIPMA, and as you all know, JIPMA is a wonderful institute, one of the top undergraduate institutions in the country, and with beautiful buildings and excellent hostels where they whitewash once every month, even whether you want it or don't want it. Their rooms are whitewashed, the buildings are kept up, and so on. And that's where I felt the fish out of water for the first time, because everyone seems to be a topper in school or college and this and that and that. And everyone seemed to be better than me. And that's a cosmopolitan institution where people are there from all over the country and some from abroad as well. The problems I had was I was poor in English as compared to the rest of them. I poor in etiquette. I didn't study in Lawrence School, Lovedale, or Hyderabad Public School, where most students came from. And this was another major issue. I haven't played any sports. I was in poor in sport. And all the girls in the first MBBS, second MBBS liked fellows who are very good at sport and made friends with them. Nobody made friends with me. And that led to a great low self-esteem. And strangely, anatomy was very, very difficult. First of all, to read from Gray's Anatomy. The print was so small, the diagrams were so many, and in the anterior, posterior, medial, lateral, all that has troubled me so much. And I was in for a shock when I had to read anatomy. And then the only thing is that, you know, I could dissect the body so very well. That some of my colleagues used to call me a surgeon in the making, but that was the only consolation. Otherwise, I did very badly all over. The trouble there was your marks are put on the notice board every week, whether it's a physiology test or anatomy test. And then it's very, very shameful when your marks are low and you can't hide your face anywhere. And there was brilliance all around because students don't seem to be reading anything, but they used to do very well in exams. I wonder when they read or what they read and what was their methodology. Somehow I had a, you know, not so easy time in JIPMA Pondicherry, but somehow I managed to pass out. And then even after passing MBBS, for this PG, you see this fierce competition. Such competition that fellows who don't get the first attempt are looked down upon so badly. And then, you know, they are the last fellows to go to the mess to have a breakfast or lunch because they don't want to be seen by anyone. The ones who didn't get a PG in the first attempt. But the great thing about this place is got the finest of teachers. Actually, I mean, that set of teachers is very rare to find. And they all took personal care. We're only 65 of us, actually 50 from the general category. So the teachers knew everyone by name, and they, are worried about how a particular candidate is doing. They used to take extra classes and all that. And then in addition, if it is general surgery postgraduates, they'll take evening classes for 3 hours, 4 hours for the undergraduates. And the senior postgraduates in general surgery used to take classes for the junior postgraduates. I mean, evening, all the wards in JIPMER are full, students sitting around a patient and teachers, the postgraduates take class. That's a wonderful thing I saw there. And of course, the very traditional JIPMER is focused on ethics and moral uprightness. This is not taught, it's just believed. It just comes into the genome very quickly. And more than anything, it gave a very sound basic foundation for everyone. We've been exposed to all small surgical procedures like a venesection, putting a central line, and the right methods of wound dressing, all little things, circumcision. These are taught. It is there in your logbook that every house surgeon should have done so many. Even when I am posted in gynecology or some other posting, if it is my turn to do a circumcision, they'll trace me back and call me back. And so all the interns passing out of JIPMER taught some very basic surgical things. Of course, we had some very renowned and eminent teachers like Dr. Radhakrishna, and we actually, I always thought that I'm not made for medicine because all medicine fellows are very brilliant. They wear thick glasses and carry Harrison wherever they went. I couldn't do all that. I used to take life very easy. So I thought people who aren't that brilliant had to take up surgery, and that's how I moved towards this. But Radhakrishna was a very good surgeon, very good teacher, and we had Robinson Smiles, who was an extraordinary surgeon. I mean, his dexterity is something seen to be believed. And then, of course, we also had Dr. Mahendra Bhandari, who was our urologist. And I also had seen him operate a couple of times and wondered what magic is there in his hands. Later, Dr. Mahendra Bhandari has gone places, and now he's behind the Da Vinci robo marketing and so on. Now, I couldn't get MS General Surgery in JIPMER Pondicherry, but I got it in Stanley Medical College. So I thought, okay, I should move on because my idea was to take up cardiothoracic surgery as a career. So for that, you need to do general surgery. And then I went to Stanley Medical College. It's a cultural shock because for all the discipline, all the academics, all the organized structure in JIPMER, Stanley Medical, just the opposite. It looked like some sort of a picnic for me for all the 3 years there in Stanley Medical College. The duty days, we used to come once in a week, a celebration. We used to have masala vada, we should have rose milk, we should have dinners, and chit-chatting and nothing. Any surgery, we used to scrub and just finish off. We never talked about signs of surgery, indicated surgery, but that was very memorable. And then there's no structure, there's no protocol, no any daily teaching, nothing. And it's all some sort of a self-learning. My 3 years of general surgery, there were no role models, I should say, at that point of time. And actually, strangely, we used to have 4 or 5 consultants. Each of them used to do a bowel anastomosis in his or our own way. We didn't know which is the right way. And we used to often get confused. Even hernia surgery, different people used to do differently. There were surgeons who never did vagotomy, and they felt that, Indian patients are not vagotonic. It's not necessary to do vagotomy when you do gastrointestinal obstruction. Then there's somebody who will do only the anterior vagus, but they are not able to catch the posterior vagus. So anterior vagotomy is good enough, and so on. So we were all confused, and we never had an idea. All that we enjoy our stay in operation theater because this is so many people and so colorful and so on. Faculty leave the hospital by 2 o'clock. After 2 o'clock, the hospital is empty. Even if I'm doing a cut down or some cervical node biopsy, start bleeding, there's no consultant whom I can go to. That was the situation. And then many anesthetists and even surgeons, by the time it's 11:30, 12, they're getting ready with their private case somewhere outside. And so, either the case is cancelled or hurried up and the list is sort of shrunken. So we wondered that, it is a part of life that, you have to have private practice at 2 o'clock and hospital practice before 2. The biggest biggest attraction, I should say, very pretty interns. Surgery pages, and I always felt that is the area where, I lost out, because, you spend time with them. Every month, some newer people used to come and new friendships and so on. Wasted a lot of time. I hardly read anything. So, in summary, I learned very little during surgery. Maybe by the time I finished general surgery, I could do a hydrocele, because that's what I did most of the time. Simple hernias, because some hernias, there was no laparoscopy that time. They look very complicated. Sometimes you don't take the layers properly. The whole thing look the same reddish brown. I don't know which is what. And then, of course, some lipomas and some circumcisions I could do. And I have never learned any decision making, poor clinical decision making, wasted a lot of time. Actually, frankly, at that time, I didn't know there's anything like a super specialty entrance and you should prepare. Never read anything for it. And then I joined government service, Tamil Nadu government service, and a primary health center service for a year. And that's the time I found some time. And then some seniors told me, now you can't spend your time after doing general surgery in a primary health center where you treat fevers and scorpion stings and so on. You should move forward. So you should read some entrance. So I got hold of one urology MCQ book and read it fully. And then I could get into the All India Institute of Medical Science MCH urology. I'll come to it. But then at that time, when I was in Stanley, Dr. Venkatasamy is a very renowned hand surgeon, and his unit was of a world-class unit. I did spend a couple of months in his unit, and I saw him very close quarters. He's the one who inspired me a little bit. But more than that, that Rangabhashyam, he was the chief of GI surgery, is another giant in Madras at that point of time. We were all so scared to see him from a distance. And that's another gentleman who inspired many of us at that point of time to think in terms of GI surgery. Now I joined urology in All Indians in Medical Sciences. That's the time I was there for about 4 months when there's a huge Karmachari strike, and then I could get time to prepare for Tamil Nadu entrance, and that's when I wrote both urology and surgical gastroenterology. There were only 2 seats at that point of time in the whole of the country. I mean, whole of the country, incidentally, because these seats are only for people from Tamil Nadu and for nobody else. So, I fitted in the bill, and I got both urology and surgical gastroenterology. And some friend told me, there are 22 urologists in the city of Chennai. You'll be the 23rd. There'll be very few gastrosurgeons, so you should take up surgical gastroenterology, forget urology. That's when I left urology and joined Madras Medical College. But I should tell you that my stay in Madras Medical College was an absolute disaster. There was again no syllabus, there's no structure. To speak the truth, there's no training. Actually, for that matter, Dr. Rangabhashyam didn't know whose MCH postgraduates are. He hardly knew, and he didn't have any time for any of this. He was that was his retiring 1 or 2 years, and he's always bothered about how to extend. He's a huge personality and a very tall leader in terms of surgery, and is much ahead of times. There was the gastrosurgeons are dealing with ERCP and gastroenterologists weren't. Then they had lasers, they had staplers, you name anything which is available anywhere else in the world was available in that unit, but postgraduates are not exposed to, or they're never bothered about. So my job as an MCH trainee is to assist hydroceles and rarely hernias, and that's all I did. Again, Madras Medical College, the hospital closes by 2 o'clock. By 2 o'clock, everybody disappears, and then nothing happens. I always used to wonder, if you were to work between 8 and 2, how can you do big cases? How can you have journal clubs? How can you have teaching sessions and so on? So again, there's a bit of self-encouraged learning. There was no encouragement from any of the faculty. Nobody wanted anybody to know anything. So finally, luckily, I passed first attempt. One of the very few to pass first attempt. I had a paper degree, but I don't know any GI surgery. I do not know where to go, where to get trained, and who will teach me operative surgery, and where will I get a placement to work. And that was the situation. And that's where I met my future wife, Dr. Selvi, she was a very good student and very close to Dr. Rangabhashyam, and she was very encouraging and helped me in my thesis, etc. I now thought we'll get married, but fate decided otherwise. And we are from two different states and two different backgrounds. So marriage was not agreed upon. So she said one thing, I'll go off to UK, you join me, then, after that we'll stay there. We need not come back and we get married there. By the time she did a flap and went to UK, and then from there, she told me, you'll be very disappointed after coming here because you've done MCH, you come here, you're going to do lumps and bumps and varicose veins only. You're not going to do any high-fi GA surgery. The best place for you to go to is AIIMS Delhi. So I didn't know how to go to AIIMS Delhi. There was one post of senior resident surgical gastroenterology opened up in Nizam Institute of Medical Sciences. There's one department there. In Nizam Institute, Hyderabad. So I applied, I went, and my home is only 2 streets away. There, the bosses were not at all in favor. They told me so many things. They said, this is not the institution for you. You have to go to All India Institute. They never allowed me to get in. So I had no choice but to go to the All India Institute of Medical Sciences. Luckily, at that point of time, there's one senior resident post was available, but then that also has an entrance of about 40 people writing the exam. I wrote the exam and qualified for the interview and got into the senior resident position and post MCH. So the director wondered, your MCH and what will you do as senior resident? You are overqualified. I said, I'm ready to work in any position, sir, including junior resident in all Indian medical sciences. Actually, I should admit that I was the most unwelcome guest there. I knew Hindi. I'm from Hyderabad, but most people thought I didn't know Hindi, and they used to chit chat saying, "Ye idhar kyun aa gaya? Why the hell did he come here? And what is that he can do?" and so on. Unfortunately, I didn't know any operative surgery, but I have no choice but to just keep quiet. And that's the most excruciating part of my life, I should tell you. One is I'm new to that weather, so cold in the winter. I joined in the winter. And, I had done 3 years of senior residency. I had to learn surgery from the scratch. Of course, there's nothing for me to unlearn to learn. So it was not that difficult. I had to learn from the scratch. It's a different world altogether. Actually, that was the toughest and the most brilliant boss I have ever come across. There are no working hours. It's 24/7. There's nothing like lunch. One day I went for lunch when Dr. Nandi was asking for me. I said, I went for lunch and all hell broke loose. From then, my colleagues called me and said, never mention lunch. Whenever you get time, you eat. So everybody who joins the unit, there are no MCH fellows. I'm the only one, actually. None from the department. They have to do 6 months first on call, where they have to write the case sheets, collect blood samples, collect reports, don't go to the theater. I'm the only fellow in the history of GA surgery, all in medical science, to do 9 months first on call. At the end of 6 months, the number 2, number 3 told Dr. Nandi he's not fit to be second on call yet. And then they thought I'll leave and go. I went outside and I cried for some time. I came back. No, sir, I'll continue. I don't want to leave and go because, it's like this. When you go on rounds, there'll be 12 fellows on rounds. Dr. Nandi used to ask a question and ask all the 12 fellows. I'm the 13th fellow. I'm the last fellow to answer because they say, if you people do not know, he will know. But my answer is already spoken by somebody already. After 12 options, I have no options. So then he'll say, you don't know? How is that you do not know? So there are so many times I had to cry and wash my face in the treatment room and go on. I did 9 months first on call. Nobody has done. All my colleagues who have done MS general surgery only, they do 6 months first on call and then they shift to second on call where they'll be operating. And the first on call will still be writing case sheets. But I stood on, then life slowly opened up. They understood that this fellow is no threat to any of us. And then in the process, I made many, many good friends who are good friends even now. When I finished my training in all Indian medical science, I can perform Whipple's procedure, esophageectomy, sphenorenal shunts independently without any hesitation. Now I consider in retrospect Samran Nandi as my God in surgery. He's such a disciplinarian, and He believes in so many things which many of us follow, which I never seen in either Stanley Medical College or Madras Medical College. Everybody in the unit should do the same thing. An anastomosis is 5 centimeters, it should be 5 centimeters only. If it's 2 vicral, 2 vicral only. Fellows used to come from all over the country. They have their own methods of doing things. No, they're just not allowed. You have to do what is followed here. Everybody should follow the same. We get so much tuned to it that even now we do what we have done there. Nothing else mattered. If it's a pancreatic genostomy, it should be 5 centimeters only. If it's 2 layer only. If you do a coloanal anastomosis, you have to do in a particular way. For everything, there's a method. For everything, and there's a big rule book for the surgical trainees that you have to follow that. If the patient vomits 3 times in the night, you have to put a Ryle's tube. If vomits 2 times, not necessary. 3 times the criteria. If you not put the Ryle's tube, then next day you're in trouble. For everything, patient has got fever, you should do total count. Total count is normal, then it could be malaria. The total count is like change the antibiotic. For everything, a system is put in place, and that became very easy. History taking, case sheet writing is the ultimate. I used to write 13, 14 case sheets all through the night. And you would write in a particular manner. You should write what happened in 1974, which doctor saw him, what happened in 1976, who operated, and so on. It's complete. And this whole history has to be read in the rounds. And if you're not ready, then that's your problem. That you have to do. Operation notes should be written thoroughly. Follow-up notes, this in soap pattern has to be written, and it has to be presented that way. Every note what you have written has to be read out. The system is such a way that you can't escape this. You can't say that I'm going to write tomorrow or day after and so on. And of course, evidence-based practice, scientific practice, and so much focus on public speaking. Each one of his residents is made to speak, and he is to correct it and shout and iron us so much. At the end of that, at least we were able to speak a little. And one of the best things in the all Indian medical is the audit system. Suppose if somebody asks somebody in Calicut Medical College as to which is the commonest cause of upper GI bleeding in Calicut Medical College, I don't know if there is statistics whether you can say it's variceal bleeding or duodenal ulcer bleeding. I do not know. What percentage of patients coming to the emergency come with jaundice? I don't know whether it's possible to say, but there in that unit, everything has a figure. Elective operative mortality is 4%. Emergency operative mortality is 25%. Then I can say in 1993, the elective operative mortality is 3.2%. In 1996, it is 4%. That is the percentage level. And then he wants to find out why there is a change. Why is there a change? And he asked me, what is the commonest cause of upper GI bleeding in Madras Medical College? I can't lie. So I said, I don't know. I don't know if anybody knows. I mean, that is the level of auditing it was. Then, of course, so much focus and research. I spent half my life in animal lab. There's rat lab, monkey lab. We were doing liver transplant on monkeys those days. And Dr. Nandi was hell-bent on learning liver transplantation. And my job was to go to the mortuary and stay there and see which is the freshest body and request those fellows. And then, call Dr. Nandi down so that we open the abdomen and do all the liver thing. I mean, he was so passionate about it. And then, like a child, he used to learn all these things. So we got exposure to animal lab. There's a big animal lab in all Indian medical sciences. Then I spent a lot of time, and all the mortuary fellows are my good friends, actually. They thought I am one of those mortuary types and not a doctor. Now, journal club. Weekly, the schedule is very, very fixed. Journal club has got a pattern. Till that time, I didn't know what journal club is, because in Madras Medical College, an article is cyclostyled or photocopied and given to everybody to read and come. One fellow will underline and read it out. I thought that was journal club, but then only when we went to the All Indian Institute, we understood that journal club is a different ball game altogether. Topic seminar. Actually, the first person to sit in the resource room will be him. 3 o'clock sharp every day, he is there. Come what may, and the rest everybody will come. it's rainy day or, floods or cyclone, nothing solved. We have to do. Nobody, there's no excuse. I mean, why I'm saying this is that I've seen a huge difference between the Madras Medical College people are very upset when I write about this, but I've seen the difference, and that's what I say. Now, we are sent to conferences in rotation. Okay, this time NCPF conference Chandigarh. Okay, 2 of you go. Next time another conference and Port Lieutenants in another place, 2 of you go. You simply can't go and come. We have to come back, give a conference report. What is the conference report? How was the audio? How was the audio visuals? Then each speaker we have to say, we have to give marks out of 10. Why you give less marks? Why you give more marks? Otherwise, if you say something wrong, you'll be scolded. So we have no choice but to sit and listen to all the lectures, share the marks, discuss among ourselves what we're going to present, and then come. So there's nothing like you attend one session and rest of the session you roam around, not possible. Conference report is a very, very important, interesting thing. And whoever, even if he goes to a conference, he'll come back and give a conference report. So it made us feel that we are attending conference. For every lecture, he wants to know what is that we can learn, what is that we can adopt. And if something is nonsense, he'll say it's nonsense. Now, one of the most interesting things that I learned is bedside duty. Nowadays, youngsters think that, harsh working, long working days, hard work is very cruel to residents, and that should not happen. I do not know. You'll not believe there's a girl called Shagufta Azmi. She is from Bangladesh who had an appendectomy and a fecal fistula. There were no bags that time. My job was to make a well with a Karya gum and have a suction and keep sucking. How long? Through the night. I mean, how many times I've done that? How many times my colleagues did? We didn't sleep through the night. That could be very harsh, but that's what we did. Then we also have an ICU. There's a GA surgery ICU. All the ventilators we have to connect. We have to sit. There's no anesthetic help and all that. So he always felt that many of the surgical postgraduates are not good in ICU management. They are only happy doing surgery, stitching and cutting. But how to be an ICU consultant is what is more important. So he just made sure that we are posted in ICU for some time and run our own ICU. We used to have a weekly, about 75 patients' X-rays are discussed in detail. There's one Dr. Rajesh Sharma, who's an excellent radiologist who is to sit and who knows all about GA surgery patients. And Dr. Nandi will sit through the entire session. So radiology was one very strong thing there. When Dr. Nandi walks into the hospital, it's 8 o'clock. You can adjust your watch. People say that, but I've seen that. He leaves at 7 o'clock. Come what may, 7 o'clock. So nobody leaves, nobody comes after 8, nobody leaves before 7. For that matter, the other consultants used to leave at 12 o'clock. They'll be working on the National Medical Journal of India. After a while, they don't like going back home. They'll just go have a smoke and come, or have one sambar, samosa, come back and continue working. I wondered, when the institutions where I had worked earlier, 2 o'clock, everybody disappears. Here, nobody disappears. If nobody disappears, you cannot also disappear. You have to keep working, and that's one strange culture. Then the best thing of GA surgery, all in medical science, record keeping. Even now, they'll bind the records and keep. They'll also have a computerized version, but then that is a very important aspect of data management. They have all actually, whenever I go to that unit now, I can see my handwritten notes, my handwritten discharge summaries bound together in huge volumes, actually. And every 6 months, there used to be assessment where Dr. Nandi wants to know how we are progressing. Once he found that I have done less number of port hypertension surgery, then he instructed his associate that, okay, next couple of cases he should do. He has to make sure that everybody is on par. Now, the most important thing I was taught there is truthfulness. When I was in Chennai, when the boss asks how much the Rylsib aspirate, if I had not seen, I'll give some number. I'll tell a lie, because that was a unit where, some 15 cases are done, is all 10 is added, whenever it's presented in conference. So that is a very, very easy tendency there. But here in AIIMS Delhi, he had to be very truthful and honest. Once he asked me, how much is that girl's blood sugar? I said 93 without seeing. Then said, come, we'll go and see. Then we went and saw it's 124. Then he called me to the side and said, Radhakrishna, you're senior, I'm just excusing. If anybody else, I'd have chucked you out. But then first thing I want from you is sincerity, honesty, truthfulness. If you don't know, say don't know. And from then on, whenever I didn't know anything, I used to say, I don't know. We had all 20 kg weight loss over that period. And that's when laparoscopy surgery has come in. Then I had an opportunity to Gangaram Hospital, where Dr. Chaube was, doing laparoscopic surgery, and he used to do about 10 to 12 cases in about 6 hours time. And like a conveyor belt surgery, then that's where we were introduced to laparoscopic surgery. Then from then on, I moved to a place called SIMS in Tirupati, where I was there for 1.5 years. Now I'm sort of equipped with some amount of operative experience, and I could do surgery. Srijan, please tell me when I'm done, because I shouldn't keep you away late night.
You can continue.
Yeah. So strangely, there were no endoscopists there. There's no gastroenterology. They had entire set of. I never done endoscopy in my life, and that's where I was in charge of endoscopy. Then you can imagine we used to do 20 upper GI-scopes, 5 colonoscopies, and about 3 to 4 major cases. And then, of course, after a year and a half, the change in administration in SIMS Tirupati, so where I had, the new retired director of medical education came, and when we asked for 6-O-proline for portal hypertension, he says portal hypertension doesn't require any proline, it requires silk. You have to just tie the splenic artery, splenic vein, and remove the spleen, that's all. I said, sir, that is not the way it is done. No, please don't teach me portal hypertension. And that's the time many of us left. I also left that. And at that time, I don't know where to go. There was a small ad in a newspaper saying surgical gastroenterology needed in Kochi. I didn't know that surgical gastroenterology is also needed in some part of the world. But then that advertisement, it said 1 lakh rupees as salary. My salary was 17,000 in Nizam, SIMS Tirupati. So I went there, and a lot of story behind. But then I spent some very good time there. There's good money, good comfort. Actually, world-class colleagues, I should say. Some of the best doctors is there. Jose Chaco Periaparam was there's a very great friend of mine, and many times he saved me when I was doing trauma. Dr. Abraham was there, George Abraham in urology, and so many in orthopedics. Excellent people. They're doing much ahead of whichever place I've seen. And Dr. T.M. Joseph was there, who was the head of cardiothoracic surgery, with Anthony as his assistant. They were doing VATS, video assist thoracoscopy, 1997, 98, way ago. But then once the central care, 7 o'clock, everybody is sort of relaxed, and everyone will have a glass of whiskey in their hand, and everybody is drunk. I'm surprised, actually. If my registrar had a couple of pegs, my anesthetist would have 7 pegs, radiologist would have 10 pegs. He'll come and he'll ultrasound-wise, he'll say the appendicitis, remove it. And that was a lot of road traffic accidents in Kochi that time, because, and then whenever I used to tell my registrar, yeah, you are drunk, how can you go talk to those people? He says, don't worry, they're also drunk. That's how it used to be. But I've got into much of it. There's a party every other day. Some party, Dr. Pulikan Varghese family is very good at giving parties, and we all used to have to go. No, absolutely academics. And then my wife said, this is not the way, you're in the early career, you can't be a care light forever. However long you live there. So I had to move out. Then at that time, one assistant professor post was available in Nizam Institute GI surgery. I had to use a lot of political influence to get in there. That is 4 years after MCH. Again, I'm not welcome there. Those people I never thought I'll join. My hometown, I was there for 2 years, no promotion. When I asked for promotion, he says, your experience is not good enough. Wife is not happy because that is Hyderabad and is not our mother's place. So then that time, Dr. Murli P. Vettat, who's a cardiac surgeon, We worked, his anesthetist was a good friend of mine who worked in medical trust, and the president of Bangladesh required lap cholecystectomy. By the time Murli Vettath is settled in Dhaka in a private hospital and doing very good cardiac surgery, the president wanted Murli to do lap chole on him for gallstones. Dr. Murli didn't know what to do. Then, he traced me and found out and said, there's one fellow in Hyderabad who can do lap cholecystectomy. That's how I went to Dhaka. So this is the medical college. That's where Dr. Murli was there. And Murli was a national figure at that time in Dhaka. Then I joined GA surgery there. That was an established cardiac unit already, but other specialties not developed, poor infrastructure. Actually, there's no concept of scrub nurses there. House surgeons act as scrub nurses. There'll be, in all the instruments, there'll be one heap actually. If you want an Alice forceps, they have to, pick out, and there's nothing. I don't know how, that's a very strange culture. Only cardiac surgery had all Indian nurses, and that was all. Other specialties had nothing. And if I have any trouble, there's no one I can ask for help because there's no surgeon I knew, no gastroenterologist I knew, no ICU specialist I knew. But then there's good money, very good money, I should say, zero academics. I stayed there for 3 years, toured entire Bangladesh, enjoyed my stay immensely there. And then I had no idea what is happening in India, whether ASA meeting or IASC meeting, Rotary meeting, absolutely no idea, no connection, completely wiped out. So that's again, I decided that that's not the way that I should move out. And luckily, there was an opening in Apollo, Colombo. And that's when I went and moved there. And Colombo is a wonderful place, I should say. It's again, a 3-year stay. Is actually the best architectural piece in the entire Sri Lanka is Apollo Hospital. We were given accommodation to the 5th floor, and that is another 7-star comfort. Lovely people. Actually, this is a island culture. Weekend people are just celebrating. They wear shorts. Friday afternoon, they disappear. Monday afternoon, they appear. In between, they are not there anywhere. Only Indians will stay on. So we had great picnics. I had good assistants, but then he started doing advanced lap surgery there. After 3 years of stay, the Apollo has to withdraw from Colombo because the ceasefire is over, LTTE Sri Lanka ceasefire. And then there's an option of coming back to India. I opted for Apollo Hospitals Chennai, but it's very difficult to get in there. The next 8 years I spent there. Again, there's much resistance to workplace. After some time, somebody told me, if you're an average surgeon, nobody will bother about you. If you're a good surgeon, then you'll have opposition. Some senior will want to get rid of you. The more resistance means, the better you are. Then I was also made to understand that, only when you have somebody puts a block to you, try to climb over it. If somebody is putting a block to you, you'll never climb over. And that I experienced there. Again, Apollo Chennai is an excellent infrastructure, great colleagues. Some of the international figures are there. Then that's why I got introduced to robotic surgery. Wife is happy more than anything because that's her hometown and children are taken care of. She can focus on her work and she did fairly well. And then after 8 years of working in, then I had an opportunity to go to another hospital, SIMS, because their protocol suited my mindset. And I'm there for the last about 10 years. We have very good interventional gastroenterology. Liver transplantation is there. We have good robotic surgery, good ICU. We have a DNBGA surgery course. So far, so good as far as my journey goes. It's just an expansion of what Dr. Srijan told about my career. There are some good things, there are some bad things, but I had a lot of fun, a lot of wastage of time, and then a lot of picnicking, but made a lot of friends. The good thing is that I learned Bengali very well, so that when I came to Apollo Chennai, every patient is Bengali patient, so I could speak well. And then, of course, all this, we had a lot of connections there. Now, when I joined SIMS Chennai, I had a lot of free time in the beginning in 2014. That's when I sort of delved into this Facebook. Facebook came just then about. Then I started this page called Learning General Surgery. I started adding people. Now, as you rightly put it, Srijan, there are about 42,400 members. And we made so many friends, unknown friends, so much so that wherever I go, like Dr. Santosh, everybody recognizes. recognized me that this is a LGS chap. Now, this Facebook group, these many members, we started a YouTube channel, got more than 500 lectures there. Then I also run what's called Marvelous Medicine every week about special topics in medicine. Dr. Vidya, my classmate, is the one who's an anchor. Then, of course, we are planning a video journal in the pipeline. And then, of course, I've done quite a few interviews, learn from the legends. Now, I think I should submit my respect to one gentleman who changed the way postgraduates are taught in India. Till he came into the picture, I had no idea what ASI is all about. I was never called for any lecture, never ever. No state, no city, no meeting. He is one who, I don't know where he gets his energy from, but he keeps working on it. I think Kerala should be proud to have him. He's completely changed the scene of the last maybe 5 years or a decade, sir, I don't know. And maybe he should be for more decades to come. Now, of course, Sri Jain is a great friend of mine. We met a couple of times, and I also visited him to observe him doing esophageal surgery. And of course, Dr. Rajan, I have a very, very special regard. Dr. Dayanand Babu is also a great friend. Now, Madhu Murali, I got in touch only through Facebook. And, he's an excellent teacher. His lectures are so sought after. Unfortunately, he became very busy once the COVID is over. I couldn't get hold of him. And Biju Puttakat is another, I think, find from Kerala, who's an excellent investigator, teacher, all in one. And then my good friend Pradhaban, whom we very, very closely interact. We met recently in the HV. They're all great. There's so many others in Kerala whom I know, whom I respect. Sorry if I'm not mentioning their names. Then my regrets are I've been in non-academic setup all through. Like, unfortunately, unlike all of you who've been in medical schools and you have very good teaching schedule, and I never stayed in one place for long. I don't know, this moving is not a great thing. When you move like this, you can't build a unit, which, it becomes big and known all over the country. And then, of course, you remain weak in academic medicine. But the good thing, sir, you have material comfort. You have money. You get more people. And fortunately, in this private sector, there's no, if you want to go to a conference abroad, you need not apply for no objection certificate, or you need approach a secretary, or you need to approach a government people for promotions and so on. And I had learned some new languages, and I strongly believe that corporate practice is future of medicine. Thank you once again for giving me an opportunity to speak. I'm speaking all about myself, but then I thought this is all I can talk about. And thanks, Dr. Sri Jain, for this opportunity.
Thank you so much, Patta sir, for that wonderful session and your words. I'm sure it must have resonated with everyone, young and old in the group. And now it's a time for our discussion. I think I'll start off. I just have two questions for you, sir. Number one, you have for several parts of during several occasions on this talk, you have mentioned about Dr. Nandi and mentorship. How do you, in your opinion, how does a student spot a good mentor and then hold on tight to him or her? What are your tips on that?
See, it happened accidentally to me. It's not that I went in search of him. Now, see, frankly, not many can get mentors. Mentors, as you go through your medical school, you'll come across somebody who takes interest in you. Like Dr. Rajan has taken interest in Dr. Sri Jain's career. That's what whenever I see the love he has for him, somebody is so bothered about his mentee. Actually, I mean, nobody can be a better mentor than Dr. Santosh, actually. He's been mentored to so many hundreds across the country. Somebody who's available, somebody who's always there to give advice, and somebody who's always thinking of something good to happen to you. I think, a good human being, then when you'll definitely be able to spot somebody in your college or in your unit even if it's not in your college, somewhere in a meeting, by the way a person from the sincerity in his words and the sincerity in his face, I mean, it's not difficult to make out that this is a mentor. But only thing is, many people are hesitant to approach, scared to talk to the person, and make actually many big people. The biggest people are the simplest people. Actually, the simpler they are, the big they are. Actually, and they're very keen. If somebody goes and talks to Dr. Raj and said, "Sir, please take care of my, can you advise me?" Do you think he's going to say no? He'll be all too happy. It's like that. It's that the students don't go. They're scared. They're afraid.
Sir, another question is, if you were given one more chance to go back and do your MS, what would you advise yourself? After having going through the training in AIMS and what happened to you later on, would you have some advice for your older self when you were doing MS in the same circumstances?
No, first of all, I would like to do my undergraduate course in a central institution. I want to do an institution where the faculty don't go away after 2 o'clock. That this is the only place of work. I don't know what is the pattern in Kerala, but then I wouldn't work in a place or study in a place where private practice is allowed. The teacher should be dedicated to the institution. Definitely, I prefer central institutions. Or there are so many other states where the faculty is not allowed the private practice, so they stay on till 5. If the faculty doesn't stay 5 or 6, why will the students stay? If the faculty leaves by 2, we all used to leave by 2:15, and 2:30 will be fast asleep. Take rest, and then it's like that.
Last question from me, sir. I am a huge fan of Selvi Madam because of the shared interest. I also am interested in breast cancer. So I visited her, attended her breast imaging course recently. So my question to you is, have you thought of advantages or disadvantages of having a surgeon as a wife, being a surgeon yourself? Or is it only advantages? From your talk, it was throughout advantages.
Definitely advantages, because she's only 2 rooms away. Now, if I gone to a room, means I'm in some trouble. Wherever I change my career from one place to another, she's the one who said it's time to change. You're not doing well. This is not the way. That's all. Whether I went to Dhaka or Sri Lanka or wherever or whatever, she's a very level-headed person. Her thinking, I feel that I don't have that capacity to make decisions. And definitely, if wife is happy, life is happy. If she is happy, she made a decision, I go by it. And that's, she makes good decisions, definitely. I think a good clinician and a very good doctor will be a very good decision maker as well.
Thank you, sir. With that, I ask my questions. Now the forum is open to all other members to ask Patta, sir.
Rafiki, if I may?
Yes, sir, please.
Patta sir, thank you for the compliments. I just have a comment to make. I think it was a wonderful session where I had kept my audio and video muted because I couldn't help myself from keeping on laughing throughout the session. But actually, you were narrating your troubles and your problems we encountered during your entire career. But I couldn't resist from laughing because how truthful you are to what you were telling, because the problems you had when you had your MS, your MCH, and then the troubles. So it was a very truthful discussion of your journey through surgery and everything. So that's my observation. Thank you for the compliments also, sir.
Patta, good evening.
Good evening, sir. Tell me, sir.
So I just have to write down, just to, it was a fantastic story. Very good story, ups and downs, difficulties faced. That's why I have written. The path to glory and in the pursuit of fineness of surgery is always a tough one. All of us, I'm sure, everyone from your residency days to probably where we are now would have gone through the difficult straits and difficult situations. You were very honest enough to say about the institutes where you did your post-graduation and super specialty. I'm sure had it not been for AIIMS, All India Institute of Medical Science, perhaps it would have been elsewhere. I'm sure, isn't it?
Certainly, certainly.
I think Samran Nandi, you may say it's a taskmaster, it's a tough guy, but then look at the way he conducts the whole department. That's where I think what Patta is now today. I think you should. Yeah, I think if had not been All India Institute, you would have been still roving around.
Yeah, very true, very true, very true, sir.
Thank you for a wonderful talk. Very, very, very candid. Nice. We'll meet.
Dr. Radhakrishna, in Dhaka, have you ever met Dr. Safrullah Chowdhury? Have you heard about his center, the Ganashastaya Kendra, GK Pharmaceuticals, their medical college? Dr. Safrullah Chowdhury recently left us in April. He was an internationally famous health activist.
Yeah, I've heard about him, sir, but I didn't meet him though.
Shafiq,
Patta,
Yes.
sir, after you, sir.
yeah, I think Patta was the first person to interview me long time back. I think the importance he is giving to the so-called zero academics in the so-called teaching institutions, and that is the reason I think he has focused on learning general surgery. I think that must be the reason what inspired him to go ahead with the academics, and the importance of using same technique. This I have experienced while I was in Florida with Dr. Gilbert hernia surgery center, where 3-4 surgeons are there operating simultaneously, but everybody will use the same technique, the same method of local anesthesia, all done under locally, the same type of incision, the same method of closure, everything same. So no question of a change of technique in that center. So that is the importance of using the, as you said in Chennai, 100 surgeons may be doing hernia surgery in 200 methods. So that is very, very important to have a structured system in the department. And of course, because of your learning general surgery, our young surgeons are maybe they all look forward to learning surgery whenever they want to see something new in the surgical learning. So once again, just like my life story, you were telling your life story. I enjoyed very much your journey through the surgery in various departments, various hospitals. So thank you very much.
Thank you, sir. Thank you, sir.
Thank you, sir. Santosh sir was saying
Shafiq.
something. Yes, sir.
Yeah. So, Patta Radhakrishna, as usual, it was an excellent talk. I enjoyed the honesty and the truthfulness in the talk was very much evident. That makes you, and that always makes you the separate one. I don't know whether I'm right in telling the crowd that probably I have known Patta Radhakrishna more than anybody else in terms of just time frame.
Right.
The moment he landed up in medical trust as a surgical gastroenterologist, maybe a couple of weeks later, we met, and the meeting was sort of a job seek for Selvi.
Right.
And I had the fortune to be with her for a few months, almost a year plus. And she was with me for in late 90s, I would think.
Yeah.
And we have, worked together and enjoyed working together. I don't know whether I am responsible for her interest in breast or otherwise.
To a great extent, yes, sir. She's not here, but otherwise, and she always keeps mentioning that.
Yeah,
And the volume of work and the speed at which you do, she always talk about it. That
And I hope you remember and recollect the situations where I have got you a couple of times to see my patients when they ran through difficulties. I hope you remember that situation also. I've never felt that taking a second opinion is, at any given point of time is bad. So two friends I would like to name. One is Patta, who used to come at least twice, I think, when we landed up in some trouble. And Puneet is another person whom I have seen for a long time. I miss both of you here at Cochin whenever there is a issue where I can trust blindly and take opinion from seniors like you. So I have been in touch with Selvi for long, and that's how I could trace you after coming back. And since then, I'm sure that you also enjoy ASI at least once in a while and once in a year at least.
Very much.
So thank you for those
Thanks.
compliments too. May God bless you with all abundance in health, wealth, and prosperity. Thank you.
Thank you so
Thank you.
much. Sir.
Thank you, sir.
Thanks.
I think it's time to wind up now. Srijan sir, closing comments from you, please.
No, anybody else to make any comments?
Good evening, sir. Patta sir, good evening.
Good evening, sir.
I'm Dr. Ramnath. I'm a great fan of you because you are running a very beautiful platform for all the generations of surgeons. That is Learning General Surgery. It's a Facebook page. Every day I used to search through the postings and your photographs on the beach side. I enjoy.
Oh, really?
Usually come in. and it is a very nice platform. We see a lot of people from other countries, even from South Africa, then Pakistan. A lot of people are there. They're teachers. They give their opinions and they answer the questions from youngsters. And it's a very good thing. Very good thing. Very good thing.
Thank you, sir.
And that
Thank
will
you.
be there on records forever, sir.
True.
Very
Thank
nice.
you, sir.
Very nice. Very
Thank
nice
you.
to
Srijan,
meet
sir.
you and listen to you. Thank you. Thank you, sir.
Patta sir, Dr. Pradhapan.
Hey, bro.
Sir, thank you for inducting me to the social media platform for general surgery. Because I think you are the one who identified me as a teacher in the Facebook platform, and that gave me a great interest in teaching also. Thank you for your talk. It's it was a very, very interesting one. Though I didn't know much about you, I have been with your company for long, but this is one time I could hear you completely. Thank you, sir.
Thanks. Thank you so much.
Any more comments? I think we will come to the last part of the program. And Patta sir, anyone? Any comments?
Carry on, sir. Carry on, sir.
Okay. Sir, I greatly appreciate the time and effort you put in today to the Association of Surgeons platform. And you have shared the long history of making the surgeon in you. It was a wonderful talk and really motivated and inspired from your words. Thank you very much for sharing your time. And I'll hand over the mic to Madhu Murali for official vote of thanks. Madhu, please go ahead.
Yeah. Thank you, Srijan sir. Before the official vote of thanks, once again, let me tell you, Patta sir, as rightly said by Prathapan, you have created a wonderful platform called Learning General Surgery, which not only teaches, but also gives opportunity to people like us who have been confined to our own small places onto a national podium. So I think people have started recognizing me across the country after listening to one or two of my lectures on that one, and I'm very proud that my lecture is one of the top 3 or 4 always. I used to go back and see what is the standing of my talk every week. So that was one. It was a realization that came to us that we can teach, or it helped us be better teachers. So thank you so much. And again, once again, I would request you to continue the platform in a more wonderful way. It's an excellent platform. And again, your life story, which you have mentioned right now, has been interesting, has been thought-provoking, and it's been very truthful, as I said earlier. So thank you for coming on the podium of ASI Kerala chapter. And on the behalf of ASI Kerala chapter, on my personal behalf, I thank you so much. And I thank all the senior faculty members and all the delegates who have joined this meeting. Thank you so much and good night, and meet you next
Thank you.
Wednesday.
Thank you. Thanks for this opportunity. Thank you so much.
Nice. Good night.
Good night, sir.
Good night.